As you note, just in the past few days, there have been some quite disturbing data that have been published by some other cities about the stark racial differences in not just who gets diagnosed with COVID, but also, sadly, who passes away. The most stark that I saw were in the city of Chicago, where nearly 70% of the fatalities from COVID-19 were among African Americans. We, of course, are tracking similar data here. We haven't yet seen those stark disparities in Maine, but we are keeping track of that. We are noting those disparities that have emerged in New Orleans, Chicago, Detroit, and elsewhere. And certainly if we start to see signs of them, that will be an alarm bell for us. We are not just waiting until we see those signs, though. And Dan, I want to be really clear on this. We're not just waiting for the data to evolve before we start taking action. Very, very early on, we started working with groups that we knew had individuals who were at higher risk for all types of diseases to make sure that those constituencies had information about COVID-19 and knew how to access the healthcare system, even if they did not have adequate insurance. And we continue to have those conversations to make sure the least equipped in Maine are well equipped to handle COVID-19. So we're not just waiting for bad data to appear. We wanted to think ahead on this and make sure that folks are equipped.